Periodontal disease. Periodontal means around the tooth. Again, the most common disease of the horse. And here, I think this may have been this. Not sure if this is a new skull or one I've showed previously, but you can see the bone loss here associated with the periodontal disease. And again, just some more. So we have a spike in a tooth here as a result of a missing tooth. So this tooth is no longer being worn away. But if you have a look here, this tooth was lost as a result of periodontal disease, and you've got a massive amount of bone loss there. Can you imagine how much pus you would have to have in order to eat away your bone that much? This would have been very, very painful, but no clinical signs. This is a horse with periodontal disease after we had picked all the feed out. So this was taken down in the ACT in Australia. The flies love this because it's rotting food and it's rotting gum tissue, and the flies just are drawn to it like it's Mecca. Here are some teeth that have been extracted from a horse that had severe periodontal disease, and you can see the flies just absolutely love it, and the smell is unexplainable. It's horrific. Endodontic disease. Endodontic means disease within the tooth. So this is actually a fracture through the infundibulum, so the middle of the top tooth, that has caused endodontic disease. So that causes death of the whole tooth. One of the common myths is horses don't have nerves below the gum lines. They absolutely do. This is a tooth that has been deliberately fractured in the socket, and this is in the bottom jaw, and we're looking down in here, and these are the two roots of the lower cheek teeth, and you can see here is the pulp of the tooth. So it's kind of like a calamari, skinny calamari, and this is the pulp, which is made up of the blood vessels, nervous tissue and lymphatic tissue, and this is what is the live portion of the tooth. Don't ever let anybody cut a horse's tooth. That should have been thrown out a century ago. Unfortunately, still does happen today. That includes incisors. Here is the pulp of a canine tooth. So this is a young horse, so that pulp is really fat. As they get older, and this is an incisor tooth, the pulp gets skinnier. I'm just going to play this video.
This is a canine tooth that's been extracted out of a cadaver, showing the live pulp in here, made up of blood vessels, nervous tissue and lymphatic tissue. When we extirpate it or take it out, that's the pulp of a live tooth.
Okay, so more endodontic disease. So we talked briefly earlier about performing an oral exam with a light and a mirror. This is one of the reasons why you want a light and a mirror, because this disease can't be felt. It has to be seen. So here we have a normal looking tooth with the pulps or the secondary dentine that overlies the pulps. That looks fine. But when we look down in this tooth here, even blind Freddie can see that this pulp does not look like all the others. So this is actually an exposed pulp. We were able to get a special probe, a very, very skinny probe into here, and this is packed with rotting feed. And again, on this tooth here, we can see that this pulp, this pulp, this pulp, this pulp are all abnormal. They're all exposed, whereas this one is normal. And this is a top tooth, so this has additional structures called the infundibulum, and they're completely normal, but this is a dead tooth. You can't feel this, you have to see it. All of these pulps, they are all named. We have a special system for naming them, and that's because we need to be able to complete a dental record and actually record our findings. And a dental record is actually a legal document. So if you are having dentistry done with your horse, they deserve to have the opportunity to be diagnosed and therefore treated. So really they should be sedated, they should be examined with a light and focal mirror, and they should have a complete dental record, which is a legal record provided to you. And of course, this is something that only veterinarians can legally sedate horses. So this is something to go to your equine dental veterinarian with. Some more endodontic disease. So lots of pictures for show and tell here. So again, using the mirror, this is an exposed pulp here. So this is a dead tooth. This is the probe that we put in. This should be like glass. When you scratch it, it should make a sound like glass that is very tough and is covering the live portion of the tooth, but this tooth has died and therefore you can put the pulp in. And again, this is another tooth with a pulp exposure here. Some more show and tell exposed pulps here that we're putting our probe in. This is a different type of disease. This is called EOTRH that causes resorptive lesions. And here we can see a probe going in, and this also goes into the pulp of the tooth, but just from a different direction.